All right, the recording has started and everybody has signed all of their consent forms that they consent to be recorded and pictures taken. I will let this one person in out of kindness. Okay, but seriously, for now, no more people are in. Everybody who's in is in, and everybody consented and we're being recorded. Now, today, well, let's start off with a very easy question. What is the name of the game that we are playing today?
Pharmacology face-off.
Yes, spelled with a PH for face. See what I did there? Okay. Now, if you are already ahead of the game and you've taken a sneak peek at next week's lecture, has anybody looked at the assignment for next week? Because I have divided you into categories. People whose last names are, or first names are A through D are doing research on EEOC. People whose first names start E to M are researching FMLA, and N to Z they're researching ADA. Is anybody ahead of the game and saw that already?
Yeah.
The reason I bring that up now is because that grouping is the grouping that we will be using today for the pharmacology face-off with the PH. And as long as everybody's here, the team should be about even. So I have, and just to make it clear, the only person who was on like the middle, alphabetized by first name, Isha. So you're in the FMLA group. So just this is going to be your team name. So Team EEOC is Aditi to Dylan. Team FMLA is Isha to Molly, and Team ADA, I'm writing this down because I'm going to keep score. Nadine to Vismaya, okay? Does everybody understand how the teams are broken up now?
Yes.
Very good. I like it. Now, I love the I guess if I had to rank participation, my least favorite is no participation. My second least favorite is people who are replying to the chat because, again, it only comes up for 2 seconds. And if multiple people chat at the same time, then I really get confused. What is Dr. Waggle's favorite method of participation?
Speaking.
Yes, talking out loud. Perfect. Okay. I love it. Okay. So if let me pull up pharmacology face-off for today. So my understanding, it was like the easiest 100 points I've ever seen. Is all you had to do is say that you are interested in pharmacology, and what the no is no, I don't care to learn about pharmacology and I don't want to go into healthcare. 0 people picked that option, so that's good. So that would imply that every single one of you had prepared for the pharmacology face-off. So I am going to pick up the question. Now, I did have a secondary assignment to this, and that was note-taking. Obviously, for those of you who just submitted your assignment 40 minutes ago, I've been unable to look, but for those of you who finished it quite early, I've already reviewed your notes, and I gave you 10 extra bonus points for finishing early. So we won't be focusing so much on note-taking today, but I'll definitely get to it. What we're going to do first is see, maybe you took horrible notes, but you retained everything fantastically, and then you do really well on the game today. So what we're going to do is we're going to see if you're able to retain the knowledge from the pharmacology video, and if you're able to subsequently spout off this knowledge aloud. Okay, so the question is, please take notes on the video. Look up the terms you're not familiar with. So I saw a lot of people wrote things down that I feel like there's no way you know what it is, but then you didn't look it up. And so when we do the note taking, I will point that out more. Unless you guys are masters and you wrote things down and you already knew and you didn't need to look them up then. Let's see, during your July 22nd at 5:30 class. That's right. Oh, you'll be divided into teams. So I divided you into teams already. Is anybody unclear about what team they're on and what their team name is? Okay, very good. All right, so I divided you up, and here is how the points are going to be distributed. I will ask questions related to what was discussed in the pharmacology video. Your team will be given a point for the first right answer given out loud. The catch is that only 3 points max per person, because I hypothesized that if each of the 3 teams have one really outgoing person that really reviewed the pharmacology lecture, they're going to answer every question. And that's not teaching you guys the importance of teamwork. Now, without looking, who remembers why it is important to have teamwork when working in the hospital? Bonus points if you remember the color of the team that I was on.
Because it affects the
It's
patient and you were on the green team.
Yes, the patient, it affects the patient, and I was on the green team. Exactly. Okay, so I don't want just one person answering all the questions. So you're going to be maxed out at 3 points. So if you're the person who's outgoing and knows everything, once you get to 3, you're not allowed to answer anymore. And that, it's like, when you do a group project and it's just really one person carrying the whole team, that doesn't work in the hospital. Everyone has to work together. There can't be like these slackers that just let the other people take over for them. So this is not only teaching you pharmacology, it's teaching you how to work as a group. Because if you were a patient and in the hospital and like you had a stroke and it was the neurology team treating you, would you just want, 'cause usually how the teams are divided, let's just say like average is like 5 people on the neuro team. Would you just want 4 people to be slacking and not paying attention to your diagnosis and not noticing that you're unable to move your left foot? Or would you want all of them working together? Which one would you want?
All of them.
All of them.
All of them working together.
Yes. So we're learning pharmacology and we're also learning teamwork here. Okay. So, Riley, can you confirm that it's recording, or is that not something you can do?
It says it's recording.
Oh, well then, thank you. You answered my question. Oh, I love your headphones. They're like millennial pink. Okay,
Thank you.
so let's see. Just to recap, if Team A, oh, Hafsa, please mute. Yeah, thank you. Okay, so if Team A has one team member willing to answer the questions and all the other team members are unwilling, what is the maximum score that team can get?
3.
3.
3 points. If Team B only has 2 team members willing to answer and all the rest of the people either didn't pay attention to the video or are unable to speak out loud, what is the maximum amount of points that Team B is able to get?
6.
6.
6. Okay, I guys have got the gist of this. All right, so we're gonna work on, are there negative points? No, because I want you guys to practice speaking out loud, and I'm trying so hard not to be cynical. I was gonna say you might get yelled at for stating the wrong answer in medical school. I don't know, maybe you'll go to a nice medical school. I am not gonna yell at you for having a wrong answer. Usually if it's a wrong answer, what I say is that's not it, but thanks for speaking out loud. No one will be punished for participation. No negative points. Good question. But the question would have been better if it was out loud, right? Right? Okay. Okay, so the entire team will suffer if there are people on the team unwilling to participate. Okay. Are we ready, or do we need any further explanation of how the game is going to be?
I think I'm ready.
Okay. Only Venkat is ready. That's good.
I'm
I guess the
ready.
rest of you.
Ready.
Ready.
I don't mind if you talk over each other. It's obviously if we were all in the same room, it would be easier if there are multiple people talking for me to know like who to call on. But if I hear many people talking at the same time, I will just try my best to pick out whichever person I think started talking first. Okay, so, but if you obviously know that somebody else is already in the middle of answering, then obviously don't shout out the answer. Let that person finish. Woo! Okay, so I'm gonna get out my notes and we're just gonna start. So the first question is gonna be, What was the reason that I decided to talk about pharmacology in the first place?
So we
Because
can have a head start
ahead
before
of
going to medical school, since it's one of the harder subjects in medical school. And then we'll seem smart.
Okay, who? I need the name. Gabby?
Yeah, that was me.
All right, so Gabby is on team FMLA. Okay, thanks, Gabby. Can you guys just do me a favor, and we're gonna go on the honor system, and Gabby, you're gonna mark down that you've already answered one, because the way that my spreadsheet is going, when I click X on Gabby, for some reason it's going down. So Gabby, you will just have to restrain yourself from going past 3, but I have marked that you did one. So yeah, I will accept that answer because that was actually written in the description that, and I said at the beginning, like, it'll put you ahead, and I don't expect you to know pharmacology because you're not in medical school, but it will be impressive. So I did say that, and I will give you the point. The answer I was looking for was because when we talked about the anticholinergic medications last time, nobody knew what they were. And that's what originally made me think, like, oh, well, it would be good to go over some medications in general. But I absolutely did say almost word for word what you said, Gabby. So you get a point. So team Riley, would you be able to keep well, I guess I could too, but
It's
this is-
okay. I'm already keeping score, Dr. Weigel.
Oh, Riley, you're on fire. Okay. Team FMLA has 1 point thanks to Gabby. Okay. All right. So what is the opposite of a cholinergic medication?
Anticholinergic?
Okay, and that's Anya?
Yeah.
And Anya is on team EEOC. Okay, now team EEOC and team FMLA are tied. All right, so cholinergic and anticholinergic drugs both affect which neurotransmitter?
acetylcholine.
Whoa. Gatali's name was the one that came up first, and so I just, unless she hacked my Zoom, I'm gonna have to assume that she's the one that spoke first. Gatali, it would even be greater if I could see y'all's faces. Gatali, do you mind turning your camera on? I guess if you absolutely can't. See, it's nice. See, I never did any schooling during COVID, so you have to just remember that, like, I am used to talking to people face to face. So, but I understand that you guys are different COVID-y generation, and this is how you did school and things were over Zoom. But we have to remember I'm a millennial and we did things differently. So I like to see who I'm talking to. So Gatali, your name came up first, so please repeat the answer.
Acetylcholine is the neurotransmitter responsible for cholinergic and anticholinergic drugs.
Oh my goodness, that's exactly right. So Gatali is on team FMLA. So team FMLA now has 2 points. All right. And Gatali and Gabby, you only have 2 more answers left. And Anya, you only have 2 more answers left too. Okay. So let us take a guess at what one of the specific medications that I named that is a cholinergic I'm trying to make it like not super confusing. I'm also trying to like think about, like, again, this was prevalent throughout the lecture, is that I'm trying to focus in. Actually, I'll make that a question. What were the 2 when I was focusing in on specific medications, what were the 2 categories that I tried to talk the most about?
Things that you prescribe at your practice most commonly.
Yes, that was one of them. What was the other one?
Like
that
common
we would hear
knowledge, like
often.
ones that we'd be familiar with.
Okay, so Nadine answered the second part and Jade answered the first part. I hope you guys are on the same team. well, let's see. Nadine, did you know the second half of the answer?
Yes.
Okay, so I'll give you the point. But, good jumping in there, Jade. Okay, Nadine is on team ADA. So good, you got a point for that. Now you only have 2 left. Okay, so I wasn't just going to start spouting off any random medications. Although there's certain medications that I really like to pronounce the names of, like physostigmine. But I was trying to focus in on medications that I personally prescribe a lot and 2 medications that I think the general population is familiar with and that you guys would have heard before. So those are the 2 medications that I really picked because I think that they would have stood out more than if I just picked random like score. Oh, Riley, she's typing in the score. Okay, so I feel like we're dwelling too much on the anticholinergics. Like I could talk about them all day. What was the name of the book that I like the most for learning pharmacology?
Clinical
it's clinical-
pharmacology made ridiculously simple.
That's Gabby. Oh, Gabby, you only have 1 more. Your teammates are gonna have to come in soon, All right. Yep. Clinical pharmacology made ridiculously simple. Okay. Now, who is going to be the first person to name 4 routes of administration for medications? Any 4 you like?
Oral,
Rectal, oral,
IV,
nasal,
IV,
and
nasal, and
Subcutaneous.
rectal, and drops.
So, Millicent.
Mhm.
Millicent,
Yeah,
you're
Millie.
the first. Millie, you're the first name that I saw.
Mhm.
This is actually helpful. Zoom is actually telling me the first person, I think it's first person. Hopefully it's not the loudest person. Millie, your name came up first, so you go ahead and give me 4 routes of administration.
Well, we have oral, intramuscular injections, intravenous, and transdermal, but there are
Yeah.
a lot more too.
Yeah, well, that's it. So Millie is on team FMLA. Yeah. Oh, team FMLA. Y'all are doing good. Okay. Who can name all 4 medications that I named throughout the lecture that I said, this comes in a patch? This is a little more difficult. If nobody can get it, then I will accept 3. But let's see if anybody can name all 4 throughout the lecture. I said, oh, this comes in a patch. Okay, that was
I
too
have
hard.
2.
You just named 3 of them.
Oh, I have 2, if that's fine.
Okay, Millie, hold that thought. Does anybody know 3 before we go to 2?
I
All
think
right,
it's-
Millie, what are 2?
Oh, I don't know how to pronounce the first one. Scopolamine, amine,
It's scopolamine, and you're right. And
Scopolamine.
what's another one?
And then clonidine.
Yeah. All right, good. The other ones, some ADHD medications like methylphenidates come in patches, and birth control comes in patches too. All right. So, Millie, you're only gonna have 1 more question. So Millie's teammates are gonna have to step up whenever Millie runs out. Okay. Which one of the medications did I use as a vaginal route of administration? I feel like this
The
is like
birth
really
control
off.
ring?
Birth control ring. Gabby, birth control. All right. Gabby is independently the winner, but she's also out. I'm sorry, Gabby. I'm both proud and sorry. you answered the most questions the fastest. Guys, she's going into psychology. I don't know, Gabby. I still think you should do MD, PhD. It's just something to think about. Okay, so
I'll definitely think about it.
yeah, Gabby is out, but my calculations, Riley, team FMLA has 1, 2, 3, 4, 5, 6 points, right?
Yes.
And I mean, they're just dominating, like completely stomping. That's all right. Okay. So yes, birth control ring is a vaginal route of administration. And then I didn't say it. And if you're going to go to medical school, you have to learn to talk about all these things. As a psychiatrist, I talk about what most people would consider to be taboo, like constantly all day long. I know that this is like on YouTube. I'm going to post it on YouTube, but I have to tell this story. When you were in medical school, you were so consumed by like your environment that you start forgetting what the real world is like and what other people talk about. And I had a boyfriend at the time, and we went to his family's house for a holiday, and we're all around the dinner table. And they said, Stephanie, what have you been up to these past couple weeks? And I was like, oh, I've been doing a whole lot of circumcisions. And everybody around the dinner table like stopped eating and stared at me. And I'm like, what's the problem? And then I'm like, oh, that's not something normal people talk about at the dinner table. But I'm telling you, when you go to medical school, you just talk about these like vaginal rings and rectal suppositories, and these are the type of things that you learn, and you just have to be able to deal with them and just talk about them like a mature grown up. Probably not don't do it at the dinner table, but this is, you're just gonna have to practice, but you're also gonna have to remember that non-medical people probably don't. Okay, I swear. Another thing, I went on a date with this guy, and he's like, oh, like, what did you do today? And I said, oh, I delivered a placenta. And then he really was like, I am just not hungry anymore. Anyway, I am going off on a tangent. We'll go back. So we talked about the different routes of administration, even the ones that might be considered not to be talked about at the dinner table. Let's Riley said Dr. Waggle isn't allowed on dinner dates. Okay. And then albuterol inhalation. There's all sorts of ways to take these medications into your body. Okay. Does anybody remember why I said that I'm not going to harp on you to remember the doses of the medication? And then I gave two specific examples for when you become a doctor, like why you. Yeah, Molly.
Remember one of them?
EMR.
Molly.
Yeah.
Okay, so Molly is team FMLA. Holy moly. Okay, Molly, what were the two things?
Because of EMR. Because you can just, when you're in the hospital, you can just type it in and it'll tell you. And then I think that the other one was just because it's like a lot to remember. And when you go to medical school, they'll bother you about it more.
Okay, you know what? I will accept that, because I did say that memorizing the doses is a lot to remember, and it would be so crazy of me to start teaching you guys the dosages. I will accept that. So FMLA gets another point, and Molly only has two more questions that she is permitted to answer. The answer that is acceptable because it is true. The answer I was looking for is an app called Epocrates, and man, is it a lifesaver. It's like, if you don't know the dose of something, you have to pay, and I think you have to prove that you're a medical professional. But man, it helps me with dosing a lot. So when you type in a medication in the electronic medical record system in the hospital, it'll give you the standard, most typical doses so that you don't have to memorize. And then you can also use Epocrates, and that'll tell you the doses. And it's great. It'll tell you, because if you notice when I was talking, there's a lot of medications that are in different categories, which may be a good next question. And it'll tell you, this medication, if you're using it for this disease, you prescribe this amount. But if you're using it for this disease, you prescribe this amount. So it's super, super helpful. And that leads me to the next question is, can anybody name a medication that I have brought up in different categories throughout? Like, one's a blood pressure medication, and also when we're on ADHD.
Propanol.
Magna's name came up first, so I'll let you answer.
Propanol.
Propranolol. I think I'm right.
Propranolol. Everybody say it with me. Propranolol. No.
Propranolol.
Everybody unmute. We're gonna do this as a group.
Mhm.
1, 2, 3.
Propranolol.
Propranolol. That's good. Yes, propranolol is a beta blocker. And that is an excellent example because it does so many things. All right, so Magna, also with Team FMLA. Maybe I should mix you guys up more. I feel like the middle of the alphabet here is very strong. Okay, so next question is, who can name all of the categories that propranolol fell under? Okay, most. Who can name most of the categories?
Vascular drugs.
Nadine. All right, Nadine. Also
I think I
Team
only have-
FMLA.
I
Wait,
think I
LM.
only-
No, Nadine is Team ADA. You are the N, so you're the first name in the ADA category. Okay.
And then antiarrhythmic.
Okay.
I have to.
So which one was the first one you said?
Vascular drugs.
Okay. Yeah, it is. And then you said,
Antiarrhythmic.
and can you think of any others?
Anxiety.
Yes. On fire, Nadine. But Nadine is only allowed to answer one more. Nadine's counterparts need to start helping her out. Okay, you are right. Another point for Team ADA. Okay, so this is, I feel like I need to do a whole different lecture to explain the difference between pharmacokinetics and pharmacodynamics, because I think I just very superficially glossed over it. But does anybody know the difference between pharmacokinetics and pharmacodynamics?
I think kinetics is how the body reacts to the drug, and then dynamics is how the drug affects the body.
Very interesting way of putting it. So that was Trisha for Team ADA. Oh, Team ADA is coming in strong. Trisha. Okay, now I like that a lot. Can you please repeat that?
Pharmacokinetics is how the body reacts to the drug, and then pharmacodynamics is how the drug affects the body.
Yes. Okay. So to be a little bit more specific, and I really should do a whole, but I don't want to overwhelm you because it's kind of crazy stuff. First, to distinguish between the two, I just remember K and D. Okay, so and I capital the K in kinetics, and I capitalize the D in dynamics because that's how you can like separate them in your brain. So pharmacokinetics with a K, pharmacodynamics with a D. So pharmacokinetics with a K. There's 4 things: absorption, distribution, metabolism, and excretion. So I did talk briefly about metabolism, and that will be along the lines of the next question. But the pharmacokinetics have to do with like the storage and how it's distributed and how it's absorbed in the metabolism, right? So that's over with the K, and that's pharmacokinetics with a K, absorption, distribution, metabolism, excretion. Now, pharmacodynamics with a D is the effect, the side effect. Does it make you sneeze? Does it give you diarrhea? Pharmacodynamics, diarrhea. I don't know. You remember it that way. Okay, so getting back to pharmacokinetics with a K, I did talk a little bit about metabolism. And what was when I talked about metabolism, what was the example that I said? Most people probably know that this organ metabolizes this drug. So
The
fill in the
liver.
blue. Nadine was the first name to come up. Nadine was the first name to come up. What did you say?
The liver.
Liver metabolizes.
The enzymes break down all the medications.
Well, that's not all of some things go through the kidney, but I said the liver metabolizes
Alcohol.
and then
Alcohol.
oh well, now Buvana, did I say your name correctly?
Yeah.
You're gonna be for team. Well, this is like half and half, so you get 0.5 of a point because you answered the second half. And who was it? Nadine just answered the other half? Is this?
Yeah.
All right, so just for my ability to not have to give people half points, let the person who started answering have an opportunity to finish. And then if they can't think of the second part, then you can yell out. But just to be fair, Nadine will get 0.5 points and Buvana will get 0.5 points. So yes, the liver metabolizes alcohol is the answer. Okay, very good. Now, what are the two like when you think of nervous system, there's NS and NS.
Central and
Sympathetic,
peripheral.
parasympathetic.
Gatali was the first. Please
Central and
answer.
peripheral nervous system.
Yes. Okay. So Gatali is gonna be for FMLA. Right? Gatali. I feel like you answered one. Did I not mark
Yeah,
you
this
down?
was my second time.
So you only have one more. You are correct. The CNS and the PNS. Central and peripheral. There's also an enteric nervous system, which I think is really cool, but we won't get into that. And I'll add another point for the FMLA group, letters E through M. Okay, so further subdividing, what can you divide the peripheral nervous system into?
Sympathetic. The sympathetic and parasympathetic.
Daniel! Yes. All right, so that's 4. All right, we're making a comeback to EEOC, beginning the alphabet team. Daniel, do you care to repeat that?
It's the sympathetic division and the parasympathetic division.
Okay, so I will give that to you because it is correct. But when you do your note taking, it's really important to know what because there's like a heading and then a subheading and then another subheading. And you wouldn't really want to put, all right, so there's the CNS and the PNS. You wouldn't want to put sympathetic and parasympathetic right under PNS. Under PNS, you would put autonomic and somatic. And then under autonomic, you put sympathetic and parasympathetic. So the answer to the question I was looking for was autonomic and somatic. But I like sympathetic and parasympathetic. So Daniel gets a point. Now, who can tell me the little rhymes that go along with sympathetic and parasympathetic? Like the little jingle everybody knows.
For sympathetic, it's
Sumaya. Sumaya?
Yes.
End of the alphabet, team ADA. Please name the little jingles.
So for parasympathetic, it's rest and digest, and for sympathetic, it's fight or flight.
100%. So team ADA now has 3.5 points. Are you concur, Riley?
I have that EEOC has 2.5 points, FMLA has 9 points, and ADA has 4.5.
4.5. Oh, okay.
No, wait, that's wrong. 1, 2, 3, 4. No, that's right. That's right.
Okay, so I must have fallen asleep during the other one, but yeah, man, these half points are throwing off my math. Yes,
Yeah, I had to make a whole new calculation in my Excel sheet.
Yeah, so next time somebody doesn't finish the second half, just allow them the opportunity because I don't think that my brain can take any more half points. So the sympathetic is fight or flight or fright. And then parasympathetic is rest and digest. Correctamungo. Now, remember when I said if you don't know something, look it up. Again, I should have gone into more detail about agonist and antagonist. It's also seems very straightforward, but I kept mentioning them, and I feel like I should have gone into a little bit more of a detail. But can anybody tell me the differences between agonist and antagonist?
Agonists
In
facilitate
terms of
function.
medication, not in terms of the debate team, because agonists and antagonists can mean a lot of different things in different circumstances. But obviously, I'm talking about pharmacology. Gatali, how you? This is your last opportunity.
Mhm.
Like you're gonna be out of the game with Gabby sitting on the bench here soon. So, go ahead.
Yeah, so when agonists bind, they facilitate receptor function, and then when antagonists bind, they block receptor function.
Oh, I love that. Couldn't have been any better. That's exactly the case. Very good. Okay. Now, my next question is who can name 3 things that clonidine, the medication clonidine does? It
Clonidine.
does like 1,000 things, so you're statistically very good. So, Buvana for team EEOC. All right, now's your opportunity. You have 2.5 points left.
Okay, I know that clonidine is used for hypertension, ADHD, and anxiety disorders.
Wow, that's exactly right. Another point for the EEOC, beginning of the alphabet group. You guys have 2.5 points. Okay. All right, so so who's the first person that can tell me one thing that I said about nicotine?
It's used for ADHD, I think you said. Or no, my bad.
I like that you guessed, but
It
okay,
is
you know what?
Cholinergic
Hypothetically, okay, I would never use nicotine for ADHD, but it stimulates the central nervous system. So, like, people probably could. I did know a person who, before they did races, they would put a nicotine patch on because they swore it made them run faster, and maybe it does. And this is just an interesting anecdote to remind you that nicotine stimulates the central nervous system, and it probably could give you energy. And it was a guy, so it was either Daniel Venkat. Who was it that said treat for ADHD?
I did. I got it confused with
Venkat.
caffeine.
Okay, so no, that's fine, because actually you could, and I'm not ethically or morally, but it would probably help a little bit, to be honest. I would never do it because it's addictive and that's just not the use of it. But there are definitely people that chew nicotine gum or stick on the patch in order to get more energy, more focus, to compete in races and probably to study. So although that's what would be off-label use. And speaking, I'm not going on, I swear I'm going to come back, which is called circumferential. Tangential is when I would just go off and never come back, but I will come back. At the end, I did mention, quote, off-label use, and I said you all should look that up. And I noticed in a lot of notes that were submitted, you just talked about off-label use, but didn't define what that was. So this would be a perfect example, well, maybe not a perfect example. It would be a little bit of a, I personally would not tell somebody with ADHD to go because it's addictive. You wouldn't want your patient to get addicted to something. But the point is that, yeah, it would give you energy and it could potentially make you focus more. It would not be moral to tell somebody to do it. So you're kind of right, okay?
I was also gonna say smoking cessation, but I didn't know if that was like too obvious to use.
No, that is the legitimate use. You would never prescribe somebody who's not on nicotine, because then you just get them hooked. If they were already on nicotine, then you prescribe them lower and lower amounts to get them off. That would be a legitimate use. And one way to remember that nicotine can give you energy is when I worked in the hospital and I had, in the middle of the night, because I basically live there, a nurse would tell me, like, so and so in room 403 isn't sleeping. I would always say, did you take their nicotine patch off? Because the patients would go to sleep. Okay, so first of all, you're not allowed to smoke in the hospital. So if they're smokers at home, which I swear more than half are like pack-a-day smokers, at least in most hospitals where I worked, you can't have them come in and smoke in the hospital, but you also can't just have them come in and cold turkey. Like they would just leave AMA, against medical advice. Like they would just leave and go have cigarettes. So it is very common in the hospital to give the patients nicotine patches. But sometimes they would accidentally sleep with the nicotine patches on, and that would prevent them from falling asleep. And then that would make everybody on the floor crazy, because then everybody's up like screaming all night. So that is just something to remember. Something that I found was an interesting experience is just if somebody is in the hospital and they can't sleep, check to see if they have a nicotine patch on, because more than half of the patients in the hospital are going to have nicotine patches on, because more than half of the patients I encountered were like pack-a-day smokers at home, and you're not allowed to smoke in the hospital. So thank you for bringing up nicotine. I will give you the points, because you also did add that it is for smoking cessation. So that is a point for team end of the alphabet ADA. Okay. All right, excellent. Now we already talked about scopolamine. I feel like I'm not even halfway through the lecture. Like I could definitely go on and on all day. I love teaching you guys. Okay, I'm getting too excited. Somebody tell me about lidocaine.
It's a local anesthetic.
Well, it sure is, Molly. Molly gets a point, and Molly is only having one more, and that goes to team middle of the alphabet FMLA. Ooh, they're on fire. So yeah, lidocaine blocks nerve endings in the skin. You can put it on in like creams and ointments and sprays and all sorts of things. And then I also did address it again later on when I talk about antiarrhythmic drugs, if anybody recalled that from later on in the lecture. Now, we're going to go to central nervous system. We're going to talk about neurotransmitters. Who can name 4 antidepressants of any category of your choosing? It could be tricyclic, it can be MAOI, it could be SSRI, just any antidepressants. 4 of them. Ready?
So we have Prozac, Zoloft,
Zoloft,
citalopram,
Bupropion.
You guys are all geniuses, but Jade's name was the first one to come up. So let's give her a chance. And if she can't name all 4, I'll give somebody else a chance.
Okay, I'll try my best with the pronunciation.
Oh, I will correct
Fluoxetine-
you and I will not make fun of you. So please just try.
Okay. Fluoxetine, sertraline, paroxetine, escitalopram.
You got all of them, and the last one is escitalopram. That
Okay.
is a point for Jade. All right. I love it. We're you guys are on fire. I'm telling you what. Okay, very good. That was another point for middle of the alphabet team FMLA. All right, so let's see. Who can name 3 anticonvulsants and then explain what an anticonvulsant does? Name 3. Explain what they do.
So we
Ben Cat's name came up. Okay.
So we have phenytoin, Depakote, and topiramate, and anticonvulsants basically stop you from seizing.
That is correct. And that is another point for the end of the alphabet team ADA. Okay, so phenytoin is also called Dilantin. Depakote is also called valproic acid. Topiramate is also called Topamax. Who remembers which either generic or name brand are what at least I was taught in medical school?
Generic.
You get another point. It wasn't necessarily for you, that was for anybody, but then Kat, you're out. You're sitting on the sidelines with Kutali and Gabby. Were there any other people that are out? All right, you go to the bench. Team ADA gets another point. Yes, so you did say generic. So generic, I think it's because they don't want us to be tainted by a pharmaceutical company, conflict of interest kind of thing. So they teach us the generic names. But then when you get out in the hospital and the clinic, everybody uses the brand names, and there's at least 13,000 different drugs. And so that it makes like 26,000 different names that you have to memorize. So I'm gonna probably teach you guys both of them, because honestly, like I hardly ever use the generic name anymore. Okay, so the next question is, there was a diuretic which makes you pee and subsequently decreases your blood pressure. But I also said I named it specifically because I see it so much because it's used also to treat acne in women. Sarah Phace. The end of the alphabet, team ADA. Sarah Phace name came up, please.
Spironolactone.
That's it, spironolactone. Spironolactone. That is correct. Now we're going to jump back to anticonvulsants again and talking about women. So which of the anticonvulsants did I say that I only ever prescribed to men?
Valproic acid.
Taryn said Depakote, didn't you? Unless Taryn's name came up and somebody else said Depakote, in
No,
which
I
case.
said Depakote.
Okay, so Taryn ended the alphabet. Taryn. Another point for team ADA. Yes, Depakote is my specialty is perinatal psychopharmacology. So I prescribe medications to pregnant women, and I'm usually pretty open to any and all medications because I do like a risk benefit analysis, and a lot of my patients are very sick, and so the benefit of the medication is just so great, but never Depakote. It's like so likely to cause neural tube defects, which means the baby's like brain and spinal cord get all messed up. So I don't even prescribe it to women. I just don't even go there. Okay, who remembers the one blood pressure medication I said to know simply because I love saying it?
Hydrochlorothiazide.
Buvana? Were you allowed to go? I feel like you've answered so many questions.
I think I
Oh,
did.
you answered one and a, okay, you still have more. So what was your answer?
I think it's propranolol.
Okay, so propranolol, well, you know what? Okay. I'll give it to you because propranolol is a blood pressure medication. And I do love to pronounce it. So technically you're right. But the next question, so another point for EEOC, but the next question is, what is the other blood pressure medication that I like to pronounce?
Hydrochlorothiazide.
Jade. I saw your name come up first. What did you say? Say it 10 times in a row.
Hydrochlorothiazide.
Hydrochlorothiazide. That's right. That's exactly right. Okay, next question. What was the heart failure medication that is made from the plant foxglove?
Digoxin.
K-R-I-T-H-I-K-A-A is the name that came up. So, can you please pronounce your name for me?
Krithika.
Is anybody have their camera on?
I can turn mine on. It's like dark. Sorry.
Unless you're like in a totally inappropriate, like in the bathroom or something. Can you at least?
Oh nope, it's okay. I'm in my room.
Okay, so Karthika, repeat the answer.
Digoxin.
Digoxin is, yes, that's exactly right. Another point for FMLA. All right. Now, speaking of heart failure drugs, what was we've already mentioned it once. I mentioned it in the topical anesthetic group. And then I come around because a lot of these medications are in many categories. What is one that I already mentioned in the topical anesthetic? And now I got to heart failure meds and
Lidocaine.
Sumaya?
Yes.
Yeah, Sumaya lidocaine. All right, another point for ADA. All right. Okay, everybody's doing pretty good. Is everybody okay? Okay. What is the one medication that I said like makes people pee like a ton? And do you know like both names of it?
Does it start with an
furosemide, and the brand name is Lasix.
Marissa's name came up, and yes, it is furosemide, and it's also called Lasix. So Marissa is going to be on team FMLA. And Marissa, can you turn your camera on? remember, I'm a millennial and I live in this world where like I see people's faces when oh, thank you. That's so nice. It's would be like way easier for me to remember your names if I actually saw your faces too. Think about it that way. Yeah. Okay, so Marissa, this is your first point, right? So you got 2 more if you needed to, but I don't Team FMLA doesn't really need any more points. You guys are sitting pretty. Yeah, so the medication that treats hypertension that makes you pee a whole lot is Lasix, called furosemide. Okay, so who can name 2 of the 4 stomach meds that I reviewed? Actually, I named 5. Elizabeth came up first. Elizabeth, you have your camera on, so I don't even have to tell you. Elizabeth is on Team FMLA. Elizabeth, what are 3 of them?
Zantac, Pepsin, and omeprazole.
Yeah, so Zantac, Pepsid, and omeprazole. And those function to decrease stomach acid, so they're good for like heartburn, like acid reflux. Now, who can name the laxative that I talked about that makes you go? Like if your patient's constipated.
Lactulose.
So Aisa, AYE. Can you turn your camera on so that I know who you are?
Hi.
Okay, Aisha. Okay,
Yeah.
so you're in team beginning of the alphabet, EEOC. No, what did you say?
I said it's lactulose.
And it's lactulose. And when you're in the hospital, you and your doctor, you prescribe a lot of that. Now, opposite. What's the medication if you have diarrhea and you don't want it?
Imodium.
Elizabeth said Imodium. So another point for Elizabeth. Elizabeth, you only have 1 more point left. That's another point for FMLA. And then what is the most obvious diabetes medication and the less obvious one that I said is used for all sorts of things?
Insulin and metformin.
Millie. Millie's name came up first. Millie, middle of the alphabet, Millie, FMLA, Millie. The one that's very commonly known and the other one that's used in all sorts of stuff. Repeat.
One that's really commonly known is insulin, and the other is and the one that's not really known because is metformin.
Yeah, you're right. That's another point for FMLA. Metformin, and it was, yeah, Millie, sorry, after this, you're out because that's 3 answers. Metformin is used all the time off-label for all sorts of things. And if you recall, I stated that I wanted you all to look up what off-label means. So we have 1 minute left. And so I think we're going to end on, who's the first person that can tell me about off-label use of medication?
Off-label medications are
Anya, ANYA, beginning of the alphabet. Okay, I like that. EEOC. Go ahead.
So it's when a physician prescribes
Wait
you
a
a
minute.
drug.
Hold on. Anya, did you already answer 3?
No, I didn't.
Okay. Just checking. All right, go ahead.
So it's when a physician prescribes you a drug that's not like its main purpose, like what it was FDA approved for, but it also can work for whatever condition you may have.
100%. All right, so Riley's gonna announce the scores.
Okay, I have EEOC bringing up the rear with 6.5. In second place, ADA with 10.5. And in first place, FMLA with 18 points.
Whoa, that middle of the alphabet group. Now, I know we're out of time, but the reason you guys had these fun names is because next week we're going to talk about getting accommodations for medical training, and these are just some terms that you will need to familiarize yourself with. I think everybody did a great job. The team FMLA is going to get bonus points. 18, man. That's a lot of points. So everybody did a really great job. It was nice to hear from like new people, and everybody learned how to work together. So good job. Yay. Have a nice evening, everybody.
Thank you.
Thank you.
Bye.
Bye. Thank you.
Bye. Thanks, guys.
Dr.
It was
Waggle,
fun.
could I ask you a question really quick?
Yes, but we're also being recorded and it'll be on YouTube, so hopefully it's not too private of a question. Go
No,
ahead.
it's not private. So I'm vice president of one of the pre-med clubs at Virginia Tech, and one of the things we love having is physicians come in and speak. So I
That's
just
funny because I love talking.
yeah, so Carter, oh my gosh, my voice. Carter, who's another one of your interns, is also on our board. He's the internal secretary, and we both thought it would be a good idea to ask you. So I wanted to ask you, like, now or email,
Yeah,
but
I would
yeah.
love to. But the thing is scheduling. So
Yeah, that's the
Miriam
main
does
thing.
all my scheduling. So if you email Miriam and tell her like when I can speak, she'll tell you if I'm available that day. But I would definitely need some notice because I have so much going on, but I definitely want to. So just email Miriam and then she'll find a time in my schedule and then she'll block it in my schedule so that some other person can't take that time.
Yeah, okay, perfect. Yeah, our scheduling is like super flexible. We could do whatever works for you. Typically, we have our club sort of split into committees. So we have our general member meetings, and then we have a professional committee, a volunteer committee, and a community committee. And so our general meetings last year were Wednesday evenings, but like we can make it work to your schedule. So super flexible, and then you could just like hop on Zoom. You don't have to come to Blacksburg.
Oh, okay. Well, all right. That would have been a fun trip, but yeah,
I mean, it's up to you.
will.
If you want to come, you're more than welcome to, but
I don't think I couldn't probably come anytime soon, but I always wanted to go and visit and see what it was like. But
yes,
I think
please.
let's just focus on Zoom. Well, that'll be like a trip, like a big trip later on. But yeah, email Miriam and then she can arrange that.
Okay, perfect. Yeah, thank you so much.
All right, Gatali, good job today.
Thank you.
I'm
Bye.
sorry. I have a question for Gatali and Dr. Waggle.
Yeah.
Sorry, Gatali, which club is it at Virginia Tech?
It's called AMSA, American Medical Students Association. So we're like a pre-med chapter because it's undergrad.
Yeah. Okay, so for Dr. Waggle, Gatali, you kind of beat me to it. I was going to ask her the same question. So my friends and I started the National Society of Black Women in Medicine. And so it's a program that's mainly targeted to bring more retention to those minorities who want to go into medicine. And we also have a series called Specialty. What's the Specialty? So we usually invite physicians to talk about their specialty and to go more in depth. And I feel like your specialty, and especially how you're specialized to also prescribe medication to pregnant persons, like we would have an amazing time if you were to join our series as well.
Oh, I that's like my absolute favorite thing to talk about. I could talk about that for like 10 hours straight. So definitely email Miriam. I would be delighted. It would be my honor. I really love talking about that. So yeah, you just message Miriam and then get it on the schedule and I'll enjoy doing it.
Thank you so
Millie,
much.
you go to Virginia Tech too, right?
I
Do you want to
do.
like do a collab event with it?
Yeah, you guys should hang out. We should all get together.
Yeah, that way like more people, and I'm sure that would make scheduling easier too.
Oh yeah, have like a whole bunch of people come at one time.
Do you have a plan on when you want to have your dates? Because we usually have our meetings. We plan out our whole fall and spring semester calendar for our events. So we're usually typically going to have this What's the Specialty series on Wednesdays. We can have it on a different day if that would work. But
I mean, that should work. Our general member meetings are typically Wednesdays too. This year we're a little behind on the exact planning. We typically have it planned out by now, but our president is taking her MCAT on August 17th.
Oh, wow.
So she's a little preoccupied with that, which is why I just like wanted to let a feeler out now because I know like booking speakers gets really hectic. But like we can like chat about this on the side. But yeah, no, that would work. I just thought it would be kind of cool to get all the communities together. We love having more members, so
Thank you so much, everyone.
Yeah, thank you guys. You did really well today. Good job.
thank you so much. Have a good rest of your evening.
You too.